Hi, welcome to the section of cardiology. This is Dr. Jaitly. I'll be talking to you in this video clip about something interesting that the heart does, and that is produce sounds. So what are the heart sounds? Heart sounds like lubbed up, lubbed up, lubbed up, and these are produced by the closure of the four valves we have inside the heart, and they all seem to do that in a sequence. What is the sequence? Well, let's freshen our memory. The heart is a four-chambered organ. We know that. And it's contracting the following way. The two atria contract together, which are the top chambers. They empty out into the ventricles here through these valves. And when the ventricles contract, they send the blood through these arteries into their destination. The right side will send it to the lungs, and the left side will send it to the body, the rest of the body. So, again, there are valves here. Tricuspid valve, the mitral valve, the aortic valve, and the pulmonic valve, which now hopefully you are familiar with. So once you have these four valves, as they close, they will make a noise. Lubbed up, lubbed up, lubbed up. So the two valves here, the tricuspid valve and the mitral valve, they produce a sound called lub, and that is designated as S1 in this schematic. The two sounds produced by the aortic valve and the pulmonic valve, as heard by the stethoscope, is called dub, or sounds like dub, and it is designated as S2. So S1 is produced by two valve closures, tricuspid valve and the mitral valve. And S2 is composed of two valves again and sounds like dub, and it's from the aortic valve and the pulmonic valve. So what have we learned so far? Two valves produce S1, another two valves produce S2. The S1 is sounding like lub, and S2 is sounding like dub. So there is an interval in between, and that interval is when the heart is emptying out. Because remember, when the right ventricle and the left ventricle, they contract or squeeze, these valves will close, and that's what results into this sound called lub, because the doors will close, this door and this door, so that the blood does not regurgitate back into the top chambers, and the heart is able to empty into the pulmonary artery or into the aorta from the left ventricle. So that's what produces S1 or lub. Now, as the heart begins to relax, or the left ventricle begins to relax, these valves will open, but these valves will close in order to prevent the blood coming back into these ventricles. So when these valves close, that is the aortic valve and the pulmonary valve, the sound produced is S2. So, and then there is a pause. So there is an interval between S1 and S2, and that is the time when the ventricles are contracting or squeezing. We call it systole. You see this green? That is a small interval between lubbed up, lubbed up, lubbed up. You see, a small interval. There's a small interval between lub and dub. But there's a longer interval between dub, lub. Dub, lub. So a smaller interval between lub and dub, lubbed up, pause, lubbed up, pause, lubbed up. So that pause is the diastole, and that is the time when the heart is relaxing or the ventricles are relaxing and these two valves are closing. Interesting? I hope it was not too confusing here. But anyway, the four valves, they produce the sounds. Two of them in sequence together, S1 and S2, two valves here in each, constitute lub and dub. The smaller interval is called the systole. The bigger interval is called the diastole. Okay? And again, this is a normal phenomenon that constantly is being appreciated by a physician, but should there be any variance in these sounds, then the doctor will explain to you or talk to you and advise you further. Okay, thank you for your attention and hope you enjoyed this section. It's a very interesting part of cardiology as we are learning and moving forwards. See you again into my next. Bye.